Why some people develop cancer, who is at risk. There are certain risk factors that you and me cannot avoid, that is age. So anybody 50 years and above, there is a higher risk of developing colon cancer.
To reduce the risk of this colon cancer, what are the kinds of food we have to intake, what are the food we should not take, or what are the food we have to avoid?
If there is a strong family history, especially in the first degree relative, for example, father, mother, brother or sister, if any of them have got colon rectal cancer, then that is a risk factor.
Hi, hello, namaste viewers. Welcome back to our YouTube channel. I am Shweta from Bangalore Gastro Centre. One of the most common type of cancer is colon cancer. How to prevent this and what are the precautionary measures? What are the food we have to intake to reduce the risk of the cancer? To give more information about this, we have Dr. Yogananda Reddy, gastroenterologist with us today. So let us welcome sir. Namaste.
Namaste.
Sir, what is colon cancer, sir, and who is at the risk of developing this type of cancer?
So colon cancer and also rectal cancer, they are together because rectum, we have to consider that as part of the same, because though both the cancers are similar. So colon is essentially large intestine. So what is the function of large intestine? The food is already digested in our small intestine and the liquid waste comes into the large intestine. So the job of large intestine or the colon is to suck out all the water, make the liquid waste into solid stool and push it out. So there is not much of absorption of any nutrition or anything happening here. So it is mainly serving as an organ that is basically solidifying the stool and pushing the stool out. So this is the job of the colon or the large intestine. So cancers can develop in our body in multiple places, and colon again is not an organ that is immune from cancer. So there is sometimes changes in the lining in the cells which can trigger a growth of a small, imagine like a pimple on our face. So something like that can start in the lining of the colon, and this can grow slowly, start getting bigger. And sometimes these growths inside the colon can be in the form of a mushroom. So these what we call as polyps. So these polyps start to slowly get bigger and they turn into cancer when they are of a certain size. So why some people develop cancer? Who is at risk? There are certain risk factors that you and me cannot avoid. That is age. So anybody 50 years and above, there is a higher risk of developing colon cancer. If there is a strong family history, especially in the first degree relative, for example, father, mother, brother or sister, if any of them have got colon rectal cancer, then that is a risk factor. You might have a condition called inflammatory bowel disease or IBD, which is either Crohn's disease or ulcerative colitis that has been there for a long time. So that is a risk factor. You might have inherited a faulty gene that can put you at risk of developing colon cancer. There are certain risk factors that you and me can all kind of avoid to develop the colon cancer. So what are these risk factors? These are essentially mostly lifestyle kind of issues. So by being overweight or obese, so carrying more weight, and that can be a risk factor for development of colon cancer. Leading a sedentary life, so not much of physical activity and leading a very lazy type of life can also be a risk factor. If you are a smoker, smoking is a risk factor for various cancers, including colon cancer. If you are drinking alcohol on a regular basis, that is a risk factor. If your diet is rich in red meat, and also if you are consuming a lot of saturated fat, so even though you might be a vegetarian, but if you are eating a lot of fried foods such as bakery items and junk foods like burger, pizzas, pastas on a regular basis, which can lead you to gain excess weight, this can be a risk factor. So these are all modifiable risk factors. And along with that, if your diet has got very little fiber, for example, there is not much of vegetable and fruit you are consuming on a regular basis, this is also a risk factor for colon cancer.
Okay, sir. Sir, what are the symptoms of this type of cancer?
So, colon cancers in the earlier stage, you might not get many symptoms, especially when it is in the pre-cancer stage, what we call as the small polyps in the colon. When they do start causing symptoms, there are different symptoms. For example, some people can have change in their bowel habit, so it might be worsening constipation. So there is a new onset of constipation, and it starts to get worse day by day. Or there is other way around, where they are going multiple times to pass motion or lose motions, that is going on for weeks to months. They might be starting to lose weight without trying. And the other important symptom is blood. So either blood mixed with the stool, or you're seeing fresh blood after passing stool. This should not be mistaken for body heat or simple piles, because recurrent bleeding can be a symptom of colon or rectal cancer. If you are noticing repeated abdominal pain, or if your general health is going downhill, and if your blood count, your hemoglobin is low, that might indicate that there might be slow internal bleeding. Because if the cancer in the colon is on the right side, you might not get any blood in the stool. It might be just small amount of leakage of blood that gets digested and comes out. So you may not be able to see it in the stool, but your blood count might be going down. So these are the symptoms of colon and rectal cancer.
Okay, sir. How it is being diagnosed, sir, and can it be prevented?
So colon cancer, to diagnose, firstly, we need to be aware that symptoms should not be dismissed as something food we have eaten, or some heat in our body. Because I hear a lot of patients thinking that it is something they have eaten a few days ago or a few weeks ago, especially if the symptoms are persisting or going on for weeks to months. It should not be ignored. So you need to seek an opinion from a medical gastroenterologist. So when we see patients in our clinic where we suspect colon cancer, there is a few things that we do. Of course, we examine the patient to feel for any lump or any mass that we can feel. And in some patients, we have to examine, put a finger through their anus or back passage to feel if there is any growth or a tumor in the rectum. Along with that, we do simple blood tests to see what is their blood count, iron levels, and see if they have lost weight. And the single or the gold standard for diagnosing the colon cancer is a procedure called colonoscopy, which is, everybody would have heard of endoscopy. So colonoscopy is also an endoscopy, but this is done through the back passage. So we insert a very thin flexible tube with a high definition camera and light through the back passage, through the anus, into the rectum, and take a good look at the large intestines, where we can see the large intestine with very high definition pictures, so that even small cancers, or even in a precancerous polyps, we will be able to see in this procedure. Of course, if there is a tumor, we can tell by looking at it that this is a cancer, and we take some samples to check and confirm under the microscope. Some patients, in addition to this, might also require a CT scan to look at the other aspects. So these are the tests to confirm that somebody has got colon cancer.
Okay, sir. What treatments are available to treat this type of colon cancer, sir?
So, amongst all the cancers in the digestive system, colon cancer is one of the best ones in terms of treating, because it responds excellently, provided that you pick it up at an earlier stage. So, some of these very early cancer, we can even remove them with the colonoscopy procedure itself without the need for an operation. But a lot of people who have got this colon or rectal cancer can be completely cured by performing minimally invasive operations, where we remove the tumor and get rid of the disease for good. Of course, if patients are presenting with a later stage of the cancer, there are other forms of treatment, including chemotherapy. But it is important to kind of be aware, so that it can be picked up at an early stage. So the chances of getting a complete cure is very high, especially with the colon and rectal cancers.
Okay, sir. To reduce the risk of this colon cancer, what are the kinds of food we have to intake? What are the food we should not? take, or what are the food we have to avoid?
So I think before we go into the foods, one of the best ways to reduce the colon cancer is by having what's called as a screening colonoscopy, which I already mentioned, because colonoscopy can detect the cancer even before it begins. So colon cancer is a preventable cancer. You can prevent somebody from getting colon cancer because these cancer develop from small pimple like growths in the colon called polyps. So when we do the colonoscopy, if we see the polyps, we remove them. So when we remove them, their risk of cancer goes down. So it's a preventable cancer. This is the one of the best tests, and which is used very widely in the Western world, in Europe, America. So if somebody is above the age of 45 in the United States and in the Western world, they get a screening colonoscopy done irrespective of symptoms. So this is something that in our country it is lacking. So people should be aware that this cancer is preventable by having a simple colonoscopy to screen for early cancer polyps. With regards to the foods, the foods that one should avoid are the foods which makes us gain excess of weight. So if we are indulging in foods that has got a high amount of fats and calories, eating outside frequently, eating a lot of non-vegetarian food, especially red meat, which includes lamb, goat, beef, pork. So if somebody is indulging in eating more of a red meat diet, this can certainly be a significant risk factor. And avoiding these junk foods, so limiting to special occasions. So all these kind of processed foods that have got very little or zero fiber, that has got a lot of salt and artificial kind of preservatives. Trying to also cut down on the sugar intake and sweets, because when you gain weight, that is again a risk factor for colon cancer. So trying to incorporate more of a plant-based protein diet in your routine, and keeping the non-vegetarian food. For example, if you have 7 days in a week, maybe once or twice in a week, and other 5 days try and eat more of a vegetarian based protein. Other important aspect is also, apart from the foods, is to quit smoking and also keep the alcohol intake to bare minimal. And one of the lifestyle changes you have to do is to get some physical activity, because sedentary life causes obesity, overweight. So getting regular exercise can be a significant step towards preventing development of colon cancer. With regards to what are the foods that one should eat to reduce the risk of colon cancer, foods that are highly colorful. So your plate should have variety of colors. So all kinds of vegetables, fruits, and that you should consume on a regular basis. So you need to make it a habit of eating at least 5 portions of fruit and vegetables on a daily basis. Having a cup of curd, taking buttermilk, these are things that improve our gut health. Having good fats, for example, various whole grain foods, of cutting down on the rice and eating more of whole grain foods, ragi, quinoa, wheat, and also oatmeal. And good fats, for example, olives, avocados, walnuts, almonds. So these are also helpful in minimizing our risk, and especially variety of fruits that have got these phytochemicals, phytonutrients that have got anti-cancer properties. So all kinds of seasonal fruits you should take on a regular basis. So if your diet has got high amount of fiber, which obviously comes from more of a vegetarian source, fruits and vegetables, this can be a significant risk reduction factor for developing colon cancer.
Okay, sir. So thank you so much for giving information about this colon cancer. By watching this video, viewers will definitely take precautionary measures to prevent this cancer, I guess, sir. Thank you so much.
Thank you.
So viewers, in this session, you came to know about the colon cancer and how to prevent it. For more informative videos, please subscribe our channel. Thank you.